Now, according to new figures released this week, there's been a small increase in the number of appointments scheduled with the HSE's mental health services this year. 105,403 appointments so far, including face-to-face, online and phone between January and the end of June 2020, and that compares to 103,276 for the same time in 2019, so an increase of just over 2,000 appointments. The CEO of St Patrick's Mental Health Service, Paul Gilligan, joins me on the line now. Paul, good morning.
Yeah, good morning, Sean.
There's been an increase of more than 2,000 appointments, as I said, but I have to admit, given the year that it's been and the troubles people have had over the last 6 months, I actually thought it would be more. Is that in line with what you expected, that increase?
Well, I think people are very nervous about reaching out to health services, and that's the reality. It's the sad reality. I think there's an awful lot of fear. I think people, even though they're experiencing mental health difficulties, they're trying to deal with them themselves, which is positive. But I think there's many who need help who aren't seeking that help. I mean, if you look at the research St Patrick's Mental Health Services did there in June, 27% of people are saying that they or a family member have experienced mental health difficulties for the first time during the lockdown. So that is quite significant. 45% have expressed concern for theirs or a family member's mental health. Where it comes to children, 54% of parents are concerned about their children's mental health, and 34% believe the lockdown restrictions and the pandemic have had an impact on their children's mental health. So I think the picture we're seeing is one where there's going to be an impact on mental health. I think how you access services, your confidence in reaching out to services. And when I say confidence, I'm talking about really when I was waiting to come on, I heard another ad for COVID-19. I think it's great that we're doing all that, but the downside of that is it creates fear. People worry that if they go into a hospital or they go to a clinic, that they're more at risk than perhaps other places. So I think there's that obstacle to overcome.